Action.
All right, this is going to be the medical assessment. This medical assessment is going to be for your non-traumatic injuries, respiratory complaints, cardiac complaints, OBGYN, behavioral, poisonings, environmental. First thing you want to do is make sure you have scene safety.
Steps 1 and 2, BSI, scene safety. Step 3, determine the mechanism of injury, if any.
For the mechanism of injury for a medical patient, it's going to be kind of hard. We're going to do a cardiac emergency for right now.
Step 4, determine number of patients.
We have one patient.
Step 5, request additional resources if necessary.
Since we have a cardiac patient, I'm going to request ALS.
Step 6, consider stabilization of C-spine.
I'll think about stabilizing C-spine, but where she's a cardiac patient, we're going to forego that for right now.
Step 7, verbalize general impression of patient.
My patient's presenting with mid-sternal chest pain right here, radiating to her left arm and up her left back and her jaw.
Step
She
8.
said that the pain came on all of a sudden, and sharply squeezing.
Step 8, determines responsiveness of patient.
Hi, you okay? What's going on today? If my patient talks to me, answers me appropriately, then I'm going to assume her airway is patent. I'm going to make sure I look, listen, and feel for the airway. Since she's conscious and talking to me, I'm going to assume that the airway is open and clear, there's no obstructions.
Step number 9, determines chief complaint and life threats, if any.
Chief complaint's going to be chest pain. I'm going to just do a quick scan of the body to see if there's any other major bleeding or anything else going on.
Step 10, airway assessment.
I'm going to check her airway. I'm going to have her speak to me. I'm also going to do a mental status exam to see if she's alert and oriented on the AVPU scale.
Step 11, airway, oral or nasal airway, initiates O2 and assures adequate ventilation.
I'm going to consider doing a nasal airway or an oral airway, measuring it appropriately. Since she's conscious and alert and there's a patent airway, I don't need it. I'm going to do a nasal cannula instead, a couple liters a minute, probably about 2. Hook it up to oxygen and make sure that the oxygen is flowing into the cannula.
Step 12, breathing injury management, if any.
I'm going to expose the chest to make sure I look to see. I'm going to ask her, does it hurt when I press here? Going to do a quick assessment of the chest to see if there's any injuries here and here, to see if there's any open pneumothorax, any punctures, any bruising, etc.
Step 13, circulation, you will assess the pulse.
Going to check a radial pulse because she's a medical patient. We're going to call the rate probably about 92.
Step 14, circulation, assess skin color, temperature, and condition.
With a removed partial on the glove, I'm going to assess her skin color, temperature, and condition, and see if she's pink, warm, and dry. She's going to be pale, cool, or she's going to be pale, cool, and diaphoretic.
Step 15, identifies priority patient, makes transport decision. You have a maximum of 10 minutes.
She's going to be a load and go patient because she's a cardiac complaint. We're going to give her a chest pain, a 10 on 10. During your scenarios, your TAs will give you an actual scenario, so you're going to be winging this as you go.
Step 16, signs and symptoms, the S of sample history.
She's complaining of it being mid-sternal, radiating to the left arm and up the left jaw. She's going to be complaining of it being sharp and shooting. So we're going to make her a priority patient.
And you will use your OPQRST to determine.
I'm going to ask her, when did the chest pain begin? What does it feel like? She's going to say it began about 20 minutes ago, and it feels like it's sharp and shooting. I'm going to ask her if anything makes this better or anything makes this worse. She's going to answer me by saying when she gets up and walks around, kind of increases the pain a little bit. I'm going to ask her if it radiates. Well, I already know that it radiates because it's going to the left-hand side. I'm going to ask her for a severity. On a scale of 1 to 10, could you rate your pain, please? 1 being no pain at all, 10 being the worst pain you've ever felt in your life. She's going to call this either an 8 or a 10 out of 10.
Step 17, any allergies, the A of sample history.
My allergies, I'm going to say she's allergic to a beta blocker.
M, any medications that they are currently
She'll
taking?
currently take lisinopril, she'll take Zestril, she'll take a baby aspirin a day, she'll take probably some Lasix for fluid retention. Her medical history would be high blood pressure, she's had a heart attack in the past for the baby aspirin to work, and she's taking the Lasix or the water pill for fluid.
That'll be step 19. Step 20, the last oral intake.
She had breakfast about an hour ago.
21, events leading to the present illness.
She's going to tell me she was up and doing her daily activities around the house, and she decided she developed some sudden onset of chest pain, and she's also complaining of flu-type symptoms.
Step 22, performs a focused physical exam or a rapid assessment if indicated.
I'm going to do a focused exam. I'm going to make sure I listen to lung sounds here, the mid-clavicular area, mid-axillary area. I'm going to, again, push on her chest and ask her if that makes the pain any worse or better. I'm going to keep an eye on her airway, seeing if the oxygen that I'm giving her is kind of helping her at the moment.
Step 23, obtains baseline vital signs.
Put a blood pressure cuff on her arm here, pump it up. I'm going to get a reading of 168 over 102. I'm going to get a heart rate of 94, and I'm going to get a respiratory rate of probably 22.
Step 24, performs interventions, contact medical control or go by your standing orders.
We do have standing orders for aspirin as basics, but I'm going to call them medical control just to confirm. I'm going to give him my vital signs. I'm going to give him my chief complaint. I'm going to give him the onset, and I'm going to tell him I'd like to administer 162 to 324 milligrams of baby aspirin, which is either 2 pills or 4 pills.
Step 25, re-evaluate your transport decision.
We're still going to load and go.
Step 26, verbalizes need for completing a detailed exam.
If we had time, I would do a head-to-toe exam. I would look for deformities, contusions, abrasions, punctures, lacerations, and swelling on the head, the chest, the abdomen, the legs, and the arms. But we're going to defer it for the medical.
Step 27, repeats initial assessment, also known as the ongoing assessment.
I'm going to reassess my vital signs every 15 minutes for a medical patient. I'm going to re-listen to lung sounds. I'm going to ask her if the aspirin that I gave her is working. When I actually gave the aspirin, I would give it to her in her hand and say, could you please take these and chew them up? Make sure I check the 5 med rights, right patient, right dose, right time, right route, and right drug.
And step 28, as mentioned in the last step, repeats the vital signs.
I'm going to take another set of vital signs and notice there's no significant change. I'm also going to ask the patient if she has taken, if she's prescribed any nitroglycerin, but when I got her med list, I didn't see anything on there, so we're going to stick with the aspirin.
Step 29, repeats the focused assessment.
I will, again, reassess lung sounds. I'll reassess her skin color, temperature, and condition. I might reassess her vital signs again. I'm going to ask her, how's your chest pain now on a scale of 1 to 10, 1 being no pain, 10 being the worst pain you've ever felt in your life.
And that is it for your medical assessment.